This meeting now come to order. Good morning. Welcome to the February 20th Senate Health and Long-Term Care Committee. Meeting will come to order now. Pleased this morning to welcome the nominee for the Healthcare Authority Director, Sue Birch, and we are going to begin with our confirmation hearing. I'd like to open the hearing on Senate Gubernatorial Appointment 9339 and welcome Sue Birch to the committee this morning. Good morning. And Ms. Birch, Senate Rule 69 requires that your testimony before this committee be under oath or affirmation. So if you would, please raise your right hand. And do you, Susan Birch, swear or affirm that your testimony and documents presented to this committee are truthful?
I do.
Wonderful. Thank you. Welcome to the Senate Healthcare Committee. We're pleased to have you here. I thought maybe we could begin with your sharing just a little bit about yourself and what you most hope to accomplish as Director of the Healthcare Authority.
Great. Thank you, Chair Cleveland. And I know Ranking Member Rivers is not here. Senator Becker, thank you, and members of the committee. For the record, I'm Sue Birch. I'm the Director of the Washington Healthcare Authority, and it really is a pleasure to sit with you here today, even though it's snowing out there. I hail from Colorado. That was my previous home, and somebody was razzing me saying I brought the snow. I guess I'll take credit for it. Let's just hope it doesn't accumulate like it does in Colorado. I've had the opportunity to meet several of you and to hear your ideas, your questions, your concerns about healthcare. And I want to make sure that we're off to the right start. And for that, that means that we get the right amount of care to the all Washingtonians at the right cost and in the right place. Part of what attracted me to coming here to Washington was the true bipartisan nature of your approach to healthcare and the expanded access and the innovative work that you have set out. I commit to you to continue building that relationship with all of you. My door is open, and I want you to contact me, and I want to continue working to reach out so that we can keep sustaining and building upon this wonderful work that's been set here in the state. I want to share a little bit about myself with you. I think it's important for you to understand what my key priorities are in the coming months. First and foremost, I'm a mom of 3 wonderful kids. They're all adult kids, so hopefully they'll be coming to visit. I am a second-generation immigrant from a large Hungarian family, and I've seen the impacts and the power of healthy families, and I've also experienced a lot of my professional career working with impoverished families. And I can tell you that there are profound impacts that are made with that family cohesive unit. I'm also a nurse, and I have worked extensively in rural and underserved communities, both in Colorado and volunteering in global settings. I've gone to Africa for about a decade doing quite a bit of economic development work. And I feel really strongly that health is far more than health care or health insurance. No matter where one lives, we must focus on the whole person health, meaning mind and body. This integration work is really important. And we've got to improve beyond that and move into the space of the social determinants and community health through investments in high-quality education, housing, employment opportunities, nutrition, and other upstream health determinants. Now, in my second month on this job, I'm not going to pretend to be an expert. I am still taking it all in and learning from my staff, learning from all of you and my cabinet peers. I'm still at the point of just finding out about where things are in town and making sure that I have time to take it all in. I want to share with you, though, that my top priorities, based on the conversations I've had with the governor, with you all as policymakers, and that HCA team, and the community stakeholders, and from what I've seen working in Colorado, are the following. First and foremost, integrating physical and behavioral health and supporting communities and providers as we make this change. And I think we've got a lot of work to do around really empowering and strengthening the resources we get to the direct care providers. Secondly, moving forward with our Medicaid transformation work under our federal waiver is going to be really critical. This work holds tremendous promise for improving population health, and by supporting communities in using data to focus on their health planning needs is going to be really the path forward with transformation. I say that because for me that's a little bit like redistribution of not just the resources but also getting people aligned to focus in on what's most important for their local communities and regions. Next, I want to make sure that we have successful implementation of the School Employee Benefits Board program. I think the opportunities before us about that alignment and the market forces that state of Washington has at play are enormously unique and really bode well for this state's positioning with transformation. Finding new and better ways to pay for high-quality health care in rural communities is a passion of mine, and I think we really stand to make some significant gains by leaning in and supporting our most vulnerable communities. Other ways that are important are around controlling costs, particularly in the area of pharmaceutical spend. We want also to ensure that Washingtonians not only have health care coverage, but that they have access to care, meaningful access, and that they have the information to use their coverage wisely. I really feel strongly about the age of new consumerism and self-empowerment. I think we have a wide open field with moving in that arena as well. In addition, executing the governor's vision on responding to the opioid public health crisis that is impacting our communities and many of us so severely is really important work. Of course, we can look for additional opportunities for funding all of this. I do all of my work in the spirit of public-private partnership, and how we can start attracting philanthropic organizations to join us and be partners is going to be really important, because we have to fully acknowledge that there are resource limitations, and I do think bringing private resources to blend with our public efforts is really important. I'll say that one thing Washington has going for it is its strong relationship between HCA and its sister agencies. I've had an extraordinarily warm welcome from the Department of Health, from the Department of DSHS, and I think it's really important that we keep building off those strengths of our sister agencies. And I really appreciate that Secretary Weisman and Secretary Strange have been available and so invested in all the transformation work that's upon us. So again, I very much look forward to working with all of you as we build out towards a healthier Washington, and I really thank you for this opportunity for public service.
Thank you, Ms. Birch. And Senator Conway has a question.
I have an issue, and I hope I can talk with you about it at some point, and that is the overuse in the Medicaid programs in Pierce County in particular. Our people need really to get into medical homes. So a medical home is a place where they can actually have a place to discuss their health care conditions and not just end up in the emergency rooms of hospitalization of the hospitals. And I hope that as you are a leader in this area that you kind of keep in mind medical homes. I just feel that we need, a lot of the insurers are beginning to move in this direction requiring medical homes. I'm hoping that our state health care plans can lay emphasis on that and address the hospitalization of people who should actually be going into clinics or talking to a nurse on a phone. Just if you can come by and talk with me about that, that's an issue that is important to me. Thank you.
Madam Chair, Senator Conway, you're absolutely right. I'll be happy to follow up on that conversation, because I do absolutely believe the movement towards enhanced primary care health homes or medical homes is the bedrock of where we need to go. So by pushing into primary prevention and making sure that our providers are available so that we have 100% of our Medicaid clients with primary care health homes is really critically important. And you are certainly I'm in support of your comments, because our accountable communities of health are going to help us, and our managed care partners are going to help us as we build more capacity in the primary care medical home space.
Thank you. And Ms. Birch, Senator Bailey has a question.
Thank you, Madam Chair. It's a kind of a question and a comment at the same time. Our aging population gives me great concern because I don't think we're really ready for the age wave that's really coming at us. And as a result of that, and seeing what's happening in our primary care situation, and we're not integrating, in my opinion, mental health the way we should be, especially in the aging population. So do you have any thoughts on that as to kind of what you're seeing? And I'm sure with some of the experience you've had in some of the areas that you've lived in, you'll have some experience to help us with some of those issues going forward.
Madam Chair, Senator Bailey, thank you for that question. Yes, I have the issue of healthy aging near and dear to my heart. I have quite a bit of experience, especially with rural frontier aging and building up network capacity. I really look forward to working with Secretary Strange, excuse me, about this issue because truly the first piece of work that needs to get done is this movement of the Division of Behavioral Health to our authority and to integrate further deeper into the behavioral health work. And then we can share some of those very effective strategies and work back to our friends at ALSA, and I'm going to B. Romer is just a legendary national figure, and so I do think we can strengthen our efforts around behavioral health integration for our elderly and increase the capacity for what we all know is coming, which we refer to oftentimes as the silver tsunami, but have lots of thoughts about what we're going to do to build greater capacity in partnership with our sister agencies.
Thank you, Ms. Birch. And you've outlined your priorities very well, but I'm interested in what you might see as the biggest healthcare challenge we face as a state.
Thank you, Madam Chair. What a nice, easy question you've given me. You know, I would tell you that driving towards value is the issue that probably keeps me awake at night. We have to continue to appropriately fund the parts of our healthcare continuum that need greater strengthening. So the primary care prevention side, so critically important, but we can't walk away from our partnerships with hospitals and nursing homes and all the others that we so carefully fund through our public financing opportunities. So I would say it's that drive towards value, getting kind of a multi-payer movement on board with driving towards value, meaning reining in cost and making sure that we improve quality, and getting that standardization across the board is going to be, you know, our very serious homework that needs to go on for years to come. But I will say that we're up for the challenge. The partnerships and the base that this state has in place, the work that has been laid, and the vision, I will applaud all of you because I know many of you in discussions I've said this, the level of sophistication off of our legislators in the conversations that I've had has really been amazing, and we'll be able to move faster and drive towards greater value for our state.
And what's key for me in what you've just said is our partnerships and collaboration, just something I felt that here in our state we've done really well at. So I'm appreciative of that being your approach as well. And we can't let you get away without a traditional interview question. So I want to ask, what are your most important attributes or skills that you feel you bring to this work?
Madam Chair, thank you for that question as well. So I will say that I'm a very straightforward communicator. I'm very open to receiving feedback, both positive and negative. I will follow up. I think I have a very strong record in building trust and respect in the relationships. But I will tell you that relationship building takes time, and it also takes a lot of willingness on both sides. And so with our stakeholders and with all of you, you know, it's going to take some time as I continue to develop those relationships. But I would say that I have a pretty straightforward style, and that's probably my greatest attribute because I'm a worker, and, you know, we nurses are a highly trusted profession. So I'm going to play to that and hope that that carries us forward.
Terrific. Are there any additional questions, Ms. Birch? Seeing none, thank you for being here this morning. Oh, Senator Rivers would like to make a comment.
Director Birch, I just would like to take the opportunity to thank you so much for the work that you've completed in this very short period of time. We have a lot to be proud about in our healthcare authority. We are toasted around the nation, as I'm sure you know, and I feel that the work that you have done so far has really highlighted that the people of our state and that this legislature we really have something to be proud of, and I think the more work you do, the more we'll be able to be more vocal about what a great thing we have going here. So thank you so much.
Madam Chair, Senator Rivers, thank you for that, but I'm going to receive that comment on behalf of the whole authority and also the partnership with you all and the governor's office. I mean, again, this state is aligned and very clear about its value and compassion for the people of this state, and so we'll drive hard at the authority to make this state a more compassionate, more efficient health system, not healthcare, not just healthcare, because we really have to drive towards not just focusing on the health of people, but the well-being of people. So thank you, but I'll take that back to my very acclaimed staff that really make it happen and work through holidays like all of you, and thank you for that.
Senator Becker has a question.
Thank you, Madam Chair. Mine's not a question, but it's actually a thank you to the governor's office for letting all of us, or not all of us, but some of us have a say in the interviewing process, both in the House and in the Senate, and actually interviewing more than one person and having the opportunity to meet you. And what stands out to me about you is your optimism for the future and for the people of the state of Washington. And when you talk about a health system, I am so excited. Down the line, we need to talk about how telemedicine fits into your vision. I happen to believe very strongly that'll help us in the rural communities, but I just want to say welcome.
Madam Chair, Senator Becker, thank you. And again, I look forward to working with all of you because we really can be the healthiest state in the nation. And it's going to be fun work, hard work, but it's going to be a fabulous team and partnership. So thank you.
Director Birch, thank you for being here this morning. Very pleased to have you here and look forward to have you back soon.